Hello, my name is Rebecca Burrell, and I'm going to talk to you today about voice therapy. Voice therapy, changing your voice from masculine to feminine, feminine to masculine, and non-binary. A few things about myself. My background, I have a master's degree in speech-language pathology. I have over 22 years of experience. I have specialized training in transgender voice therapy. I'm passionate about voice therapy. I think it's a great method for helping people. I'm always learning and growing. I'm also a rehabilitation manager at Middlesex Health in Middletown, Connecticut. And I'm a member of our hospital's transgender committee at Middlesex Health. My journey as a voice therapist, I have performed traditional voice therapy for over 20 years. I've addressed vocal pathologies related to nodules and polyps of the vocal folds, vocal strain. I've worked with some singing voice. So I've worked with pathologies related to voice. And my journey is that here, being part of the transgender committee, we realized that there was a need for transgender voice therapy at Middlesex Health. So we decided to start a program. I attended the focus training. I developed guidelines for what we were going to do, and we began accepting patients and began the hard work. I do this along with two other therapists at our facility, Megan Wright and Kim Palmer. What is voice therapy? So voice therapy encompasses evaluation and treatment of the voice. So first we evaluate the voice and then we treat the voice. It is grounded in, especially for the participant in voice therapy, hard work, patience. Takes a lot of dedication, a lot of practice time. Excellent listening skills are a plus. If you can hear differences in your voice, it makes it much easier for you to succeed at voice therapy, and really a desire to obtain your true voice. So some factors involved with readiness for voice therapy are not having any vocal pathology. So making sure you don't have nodules or polyps, your voice is good. It's ready to use your new voice all of the time. So I recommend that you really are ready to come out and use this new voice whenever you can. A commitment of time. So we recommend daily practice. We recommend really using your voice as much as you can and doing activities, exercises each week. There's a huge emotional investment. There's emotional changes to voice. People have an emotional connection to their voice. So you go through a time that you're saying hello to one voice and goodbye to another. So I'll talk a little bit about that later. You need to establish how you're going to practice, where you're going to practice, when you're going to practice, and who you're going to practice with. You need to develop a collaboration and trust with your speech-language pathologist. I think that's really important. No smoking. Smoking is toxic to the voice and the vocal folds. It can make them swell, so it can actually make your voice deeper. So if you're going the route of going masculine to feminine, it can be really detrimental to your voice. And then elimination of vocal abuses. So any abusive behavior that you have to your voice, yelling, screaming, that kind of thing. So our goals for voice therapy are to achieve your best possible voice. That's always a goal for voice therapy. It's really important. In achieving that best possible voice, we really want it to be authentic. We want it to be the authentic voice that you want it to be. We want to have flexibility of your voice, making sure you have good range, high, low, everything in between. We want you to have long-term vocal health. So are you able to sustain this voice long-term? And then the final thing is the acceptance of the new voice. So before we begin voice therapy, we do an evaluation. So the evaluation is usually the first session. And at that session, we obtain a baseline for voice. We use a computerized programs called the Visit Pitch and some different apps on iPads and phones and that kind of thing. You complete a voice and medical history. You answer questionnaires about your attitude toward your voice, how you feel about it at this moment. And basically, that's sort of our outcome. We do that before and we do that after. Acoustic analysis, so we would do a complete acoustic analysis of your voice. We look at your breath support, how well you're breathing, how well are you putting together your breathing, your breath support, and your speaking voice. We determine your ideal voice, and we set goals for therapy. Typically, after the evaluation session, I ask patients to bring in what their desired voice is for the next session. So some examples, they might bring an actor or a singer or someone that they like their voice. So the next thing we talk about is vocal hygiene. So vocal hygiene is your care of your voice, how you're caring for your voice. So one thing is to increase hydration, so increase water intake. Decrease vocally abusive behaviors such as screaming, yelling, abusive singing. Like I said, no smoking. I screen for GERD, which is gastroesophageal reflux disease, so heartburn. That can impact your voice. Sometimes people have voice problems due to heartburn. The acids come up and hit the vocal folds, and that's not good. I determine how much speaking you do each day. We talk about that, what your career is, what's your vocation, how to use your voice in your vocation. So next part of treatment, we look at training targets. So we look at things like pitch, resonance, intonation and stress patterns, articulation. We look at how loud you're speaking. We look at your speech rate, how fast or slow you're speaking. We look at your language choice, how elaborate you are with your vocabulary, that kind of thing. I look at your nonverbal communication. We look at things like throat clearing, coughing, those types of things. And we address body language as well. So there's different treatment techniques that we'd use depending on which way the patient wants to, if they want to go from masculine to feminine or feminine to masculine, or if they want a more non-binary voice. So one of the strategies we teach is an easy onset of the voice, and that's kind of adding a sound to each voice. We do strategies along diaphragmatic breathing, and that's good for any way your voice is going. Your breath support is your power for your voice, so think about that. It's sort of the gas for your voice. And then if you're transitioning from masculine to feminine in your voice, we teach something called forward resonance, and that's where we start, we bring things forward. And if you're changing your voice from the other way, going more feminine to masculine, we do more chest resonance, where we bring our voice further in our chest so that we sound more masculine, more resonance. You move the voice down. So there's some examples. So pitch range. Pitch range, these are pitch. One of the reasons that we look at pitch is that it's an objective measure, so we can tell from the voice where it's at. So we use the Visit Pitch, and we get a baseline. This is the pitch that you're at, and then we do a goal. This is where we want your pitch to be. This is where you can safely get your pitch, and this is where this might hurt your voice if you're trying to speak in that pitch all the time. So for a feminine range of voice, it's 180 hertz and above. For a masculine voice, it's 140 hertz and below. And androgynous, which is sort of in the middle, is 140 to 180. And in that androgynous zone, you can add elements to your voice that will make it more masculine or more feminine, depending on where you want to be. So just in my star here, I said pitch Pitch is not the only measure, but it is objective, so that's why we use it. Don't get too hung up on pitch. Somewhere in the middle of your vocal training, I do have patients say goodbye to their old voice. The process is very emotional and difficult. I ask them to thank their old voice for all it's done for them, where it's gotten them in life, and I ask them to embrace their new voice. Some patients write letters to their voice. Some patients take recordings of their old voice. It's really an emotional process to do this. And then it can help you sort of bridge to your new voice. And once you get to that new voice, you can celebrate your success, which is awesome. So this is where I would ask questions, which we're in a video chat, so we can't ask questions. There is a referral number for our department, and that's listed on the screen. There's a wait list for therapy. I know here at UConn and at Southern, they have groups for transgender voice therapy, which is great. It's students that are working under a speech language pathologist learning this, and I think they're equally as helpful for people. And then there's other places around the state that they're also doing voice therapy as well. I think my big advice is to find someone that you're comfortable with in doing this therapy, because I feel it's very emotional, and having that bond with your therapist is really important. And I think it will lead to your success. And I'm going to end with thinking about kindness, compassion, respect, and empathy. Kindness is a gift that everyone can afford to give. And I think if we all remember this, our world will be a better place. Thank you. Thank you for listening. Have a great day.